Okay. Hello, I'm Shelby. I'm a nursing student at Butler University. Today, I'm going to be placing an NG tube on Chester. I'm going to go through the steps first and then just kind of show you what to do. So the first thing that you want to do is make sure that the provider actually does want Chester to have it. Also, make sure you have the supplies that you need. I don't have a lot of them, but we're going to work with what we got. So you definitely need tape, just so you can kind of pinpoint where everything needs to go. You obviously need an NG tube. This is an actual NG tube. And then a clamp, a pen light. This is my tongue depressor. You need a tongue depressor. And some lubricant for the tip of the NG tube. You'll need a syringe. You'll need sterile water, at least 60 milliliters. Always have a glass in the room, just so you can have a glass of water. And yeah, and definitely a towel as well, which I have right here. Go ahead and put it on Mr. Chester. Okay. All right. So, what you would do is you would walk into the room, perform hand hygiene, make sure you always keep your hands clean, bring out everything that you need. Like I said before, definitely make sure the provider wants this, because you don't want to put them through it if you don't have to. Definitely assure the patient's privacy. Do 2 patient identifiers, name and date of birth through the system or the wristband. And then you definitely want to make sure that your patient can cough, so you'd ask them to cough, and then you would check their gag reflex, which just take the tongue depressor and the light, shine it back, and go back, and if they gag, it's okay. And then once you're getting them ready, what you want to do is have them sit in semi-Fowlers, which is 90 degrees. So just think of an angle like that. And you want to make sure that they can breathe. The patency is good on both sides. So just have them go. And whichever is better. Obviously this one is not good, so we would use this side, just because it's more patent. You definitely want to make sure if they have had any nasal surgeries, septal deviation, anything like that, that you know about it, just because that could affect the way that the tubing can move. And we don't want to go up, we want to go down. So essentially, once you get all of that done, and you have chosen the nose the narrow you want to go in, you just go ahead and get started. So you always walk in, like I said, make sure those semi-Fowlers. Make sure that you kind of feel to find their xiphoid process, which is about right here. Just kind of make sure you know where you're at. And then once you do that, you're ready to measure. So to measure, Mr. Chester does not have an ear, but you go from the nair that you're wanting to do to the earlobe, and then down to the xiphoid process. So we take the tip, which is the tip that's going to go down, go from the nose, and then hold it to the ear, and then from the ear down to the xiphoid process, which is down here. And then with a marker, you mark that. I have tape, so I'm going to use tape. You can use tape or a marker. Right here's my tape. And that is about how deep you want the NG tube to go. So once you get that done, you get the patient ready. And you get your water, you get everything put out. You get the lubricant ready. Water-based is better. So you would dip it into the lubricant and make sure it's all kind of coated. And then you would have them tip back, so just so you can see. You would go up the nair and down. And once you get to the down portion, you would have them lean their head forward, lean forward, and then also have them take a couple sips of water as it's going down, because the water is going to help as another lubricant. And let me take off the sling. And then pull them up. you can just kind of see, you're just going to go straight down. Make sure you're in the esophagus, not the trachea. All the way down to the xiphoid process. Which obviously you can't do this on a real person. But all the way down here. And then make sure, once you're up there, you're in the right spot. If you meet resistance, pull back and pull back and then go. When you first put it in, definitely shine a light in the back of the throat just so you can see it. Make sure you can see it. But you just shine a light and make sure that it's going the right direction and going down. And then leaning forward just kind of helps with the motion of the neck and helps it kind of go down. And then the water will help, like I said, as a lubricant. And then once you get it in, you can aspirate it, which is one of the ways that you can check it, make sure it's not in the lungs. So you would get some aspiration and then you can also check the pH of the aspiration. One of the best ways to make sure your placement is correct is just getting a chest X-ray. It's one of the easier things to do, and yeah, you definitely want to wear gloves while you're doing this. The beginning part's okay, but as soon as you start touching anything on his face or anywhere else, you definitely want to wear gloves. And then some people do, some people don't, but you can also prime this just to make sure that the tubing works. Kind of like you do with IV tubing, just make sure that there's no leaks, no holes, anything like that. So essentially just make sure that they're comfortable and make sure it is comfortable. Once you do get it into the spot, you need to tape it. So we're just going to do this on this guy. So say we're in this snare. Get a little bit closer. Okay. So I have two different pieces of tape. This one I have ripped down the middle. Can't see it. Ripped down the middle. So you would pop it on like this and then wrap it around the tubing, going two separate directions. So you just wrap that all the way down the tubing so that it's there. And it'll stay. And then I always put an extra one on top. Just another one around. And then also, if you would like, you can also tape the tubing to the side of the face. You can use a membrane dressing or like Tagaderm, that kind of thing. That is usually what they use on the face just because it's a little bit easier on the skin than actual tape is. But yeah, once you get the placement correct and make sure everything's right, you just kind of let it be. But yeah, that's really all you do. And essentially you just kind of make sure that it's still working properly, that it doesn't get clogged. If it does get clogged, to fix it, that kind of thing. And yeah, just try to keep them as comfortable as possible. It's not a fun procedure. Definitely not. So it's just kind of keeping them comfortable with the water and pretty much giving them what they need to be comfortable once they're done. But yeah, after that, you clean up, dispose of your gloves, and you'll document the size that you used, whether or not there's any pH differences, anything like that, and then how much fluid, any fluid that you took out, that kind of thing. So yeah, it's really not hard. Once you get through a couple of them, it'll be easier. But yeah, Chester was a great help today, so see you in the next one.